Hey everybody, welcome back to the channel. My name is Reed. These are EKG lectures with Reed, and today I'm going to just give you a quick overview on the different classes of antiarrhythmics, how we classify them, what each class antiarrhythmics does, just quick kind of two-liner on each of those, just so that we can organize our antiarrhythmics in our mind. And then in subsequent videos, I will deep dive into each antiarrhythmic. We'll talk about exactly how it alters the different action potentials that I had previously described in our first two videos on the cardiac and pacemaker potentials. And so to start off here, we'll start off with the classification. It is called the Von Williams classification. And so it classifies as, class 1, 2, 3, and 4. And so we'll start off as class 1 agents, and these agents are our sodium channel blocker. And our sodium channel blockers, if you take a look at this chart here, would affect phase 0 of our cardiac action potential. And so class 1, what they do is they will decrease our propagation speed as the slope of phase 0 would obviously decrease, and so we would decrease the propagation of that signal from cell to cell. So that is our class 1 sodium channel blockers. Class 1 is subdivided into subclasses. There's class 1A, 1B, and 1C, and we'll dive into exactly how each of these different subclasses affect the action potential, because they all just have a few different properties. And so, but generally we think of them as they decrease the conduction velocity. That is their primary mechanism, velocity. Our next class of antiarrhythmics are class 2. I'm going to write them in the top right. Class 2 antiarrhythmics, and these are our beta blockers. We think of historically beta blockers ending in lol, like propranolol, metoprolol, carvedilol. In beta blockers, as you by the name as it suggests, that blocks beta adrenergic receptors. And so adrenergic receptors, they're located obviously at our SA and AV node, where the SA and AV node are receiving innervation from our sympathetic and parasympathetic. Remember, our beta adrenergic receptors are a part of our sympathetic nervous system. And so beta adrenergic innervation or activation of those receptors is typically an excitatory function. It's an activating function. They're done through G protein coupled receptors, and they allow for calcium to influx into the cell and cause the heart to squeeze faster and harder. We're going to talk about all those mechanisms here in the next videos, where I dive into each of these classes. But class 2, beta blockers, and there's plenty of different flavors of beta blockers that we're going to dive into. Some that are more beta 1 versus beta 2, some that have alpha adrenergic blockade activity. So very wide spectrum of beta blockers, but that is one that you can imagine would be helpful in certain diseases where we need to slow down SA or AV node. Then our next class, which is class 3, are our potassium channel blockers. So I'll write that down here. Class 3, these are our potassium channel blockers. And specifically, as you could imagine, where is this potassium channel really highest functioning in our action potential here? And this is going to be mostly affecting phase 3, which is our repolarization. And so potassium channels are when you block them, they're going to decrease, they're going to prolong our refractory period. And what that means, right, if phase 3 takes longer to occur, then the amount of time that we are refractory, which remember in our first video we said is kind of during this entire phase of this action potential, we are unable to conduct another action potential. So if you take longer to repolarize, if you block phase 3 with a class 3 antiarrhythmic, you're going to prolong the refractory period, which ideally would slow down the amount of propagations, right? Because then it wouldn't be able to receive a signal until later on. So class 3 we think of as potassium channel blockers. The last class of antiarrhythmics that are really, classes 1 through 4 that we think about are our class, I'm gonna write this right here, class 4 antiarrhythmics, and these are our calcium channel blockers. Specifically, these calcium channel blockers are non-dihydropyridine calcium channel blockers. Non-dihydropyridine calcium channel blockers. And interestingly, what I'll do is I'll take you to this picture, which is our pacemaker potential. And remember that phase 0 was calcium influx. And so our class 4 calcium channel blockers block this inward current of our pacemaker cells. And so they really do a great job of decreasing the speed of signal through our pacemaker cells. So it can slow down your AV node, it can slow down your SA node. And so consequently, because there are some calcium influx channels that are in this action potentials, there might be a little bit of inotropic, kind of decrease in inotropy as a side effect of class 4 calcium channel blockers, because if there is less calcium inside of the myocardium, yeah, it's going to squeeze a little bit less. So that's kind of the idea there of our class 4. And then the last is, some people call it class 5. I just call it other. And these are antiarrhythmics that don't fall into a great category. Maybe they have multiple different mechanisms of action, right? We've got things like sotalol, which is a LOL, it's a beta blocker, but it does have both class 2 and 3 antiarrhythmic activity. We've got medicines like adenosine, we've got digoxin, we've got ivabradine, right? These are just some others that I'm going to do individual videos on because they really touch a funky spot on these for these ion channels that have really specific consequences or outcomes, we can say. So overall, this is our classification of our antiarrhythmics. I'm going to deep dive each video into exactly what class 1 agents, class 2, class 3, class 4, these other agents are going to be doing. We'll look at the receptors. We can see exactly what those receptors do, and then we can understand if we block or do not block those receptors, how are things going to change within the cell to create the response that we would like. So I hope that this introductory video helps you kind of organize that in your mind, and we'll go from there. Have a great day.